My child looks absolutely fine. What exactly is wrong? People say that there is something wrong in the brain, but how do we know? The MRI, most times MRI is not done, and even if it's done, the structure seems to be fine. So at Neurosurgeon, we went ahead and actually looked at really what is wrong in the brain, and this was done through functional imaging. So advanced scan imaging known as a PET-CT scan of the brain, which tells us about functioning of the brain. So structure-wise, everything seems to be fine, but when we look at the PET scan images, we find that there are certain areas of the brain which are functioning less, and that is indicated by, which is very easy to read, made it easy to read through a color spectrum. So we were explaining to the Honorable Deputy Health Minister also that, when you look at the brain with those different color schemes, you see that there are green, lighter brain, green, yellow and red, which are normal functioning brain, but deeper parts, which when we say out and we think about what do they do, it correlates beautifully. So the small part of the brain, and one of the speakers yesterday actually mentioned that the cerebellum, the back of the brain, which is important for coordination, balance, articulation, chewing, integration of functions and movements and tone, is working less, and you can see that in the PET scan. The deeper parts of the brain, known as the medial temporal, which is responsible for understanding, learning, comprehension, socialization, emotional expression, this is working. And the middle part of the brain, which connects the two brain, known as thalamus, which is a relay center, is working less. So all of this is possible only through the PET scan. So through the PET scan, we can actually find out which parts of the brain are working less, and now we get an understanding as to why our children are unable to process information or unable to respond to a lot of training that we do. So advanced imaging has really helped us go deep into a better understanding of what is autism and what really is functioning less and what is lacking in the children.
So to continue with what she said, there is new brain imaging technology, and here I will have to keep talking back to Honorable Minister Mulel that we will need this equipment in this country. This is an equipment called PET-CT scan. I'm not sure if it's available. It may be available. This is modern functional imaging, which actually tells us which parts of the brain in children with autism are not working. So if it's there, that's great. We can actually start, investigating and looking at our children. But what is functionally, as Dr. Nani said, has been found. So if I were to divide our brain into an upper brain or a higher brain, which does the thinking, the intelligence, the executive function and all of that, and then there is a little lower brain, the smaller brain called the cerebellum, and the medial temporal brain. This is responsible for the primitive instincts. This is responsible for, the basic reflexes that we have. Now, what we have found in our research, and we were the first to do this in the world, and we've published our work in a very prestigious journal called the World Journal of Nuclear Medicine. We have for the first time shown the world that there are parts of the brain that are what is called hyperbaric or not working properly, and this corresponds to the symptoms. So now for the first time we know why our children cannot talk, why they cannot read and write, why do they have all the behavioral issues, why can't they make eye contact, why can't they take care of their daily activities like brushing, bathing, food, etc. Why can't they process information and comprehend? Because there is a part of the brain there that's not functional. For example, let's say if any of you developed a fracture of your leg, would you be able to run? Would you be able to walk? You would not be able to stand. It's not your fault. It's just that if your leg is fractured, you can't walk, run and move around. But if your fracture was fixed, now you'd be able to walk. Now, this also answers a question that many parents have. Many of you will say, we have done all the rehabilitation possible and still our child is not improving. Okay, are there parents who will say that? There are parents who will say that, right? That we have done all the rehabilitation possible, our child is not improving because presently we are doing rehabilitation on brain that is not functional so much. But now there are medical technologies that can actually help improve this function. So understanding is the first step towards getting a solution. And today with the brain, the understanding comes from modern imaging techniques which include PET CT scan, MRI, EEG. MRI and EEG is available easily, but a combination of this gives us an insight, and once you have an insight into the problem, now you can find solutions.
Thank you so much. I think that's wonderful. I have a question as you speak.
Okay.
So there is this brain, you've done your imaging, you've done the PET scan, you found there's something in the brain. I've heard there are new treatment modalities, hyperbaric oxygen, therapy, ozone. What is the role of those treatments in either treating or alleviating the symptoms of this brain?
So what brain imaging has shown us is there are parts of the brain of these children which have what is called hypoxic ischemic damage. That means this brain is not receiving enough oxygen. Now, if the brain is not receiving enough oxygen, then obviously one possible solution is to give it oxygen. But just giving normal oxygen does not help. What we have found and what medical science has found is you have to give oxygen under pressure. So right now, we are breathing oxygen at 1 atmospheric pressure, all of us. Okay? And when you breathe oxygen at 1 atmospheric pressure, only the red blood cells in your body carry the oxygen. In our blood, we have got red blood cells, white blood cells, and a liquid called plasma. Right now, all of us are breathing, only our red blood cells can carry oxygen. The liquid of the blood has no oxygen. But when you give oxygen under pressure, like 2 atmospheric pressure, now the oxygen goes into the liquid. Okay, so right now in our body, only our red cells are carrying the oxygen. When you give it under pressure, the entire blood is carrying oxygen. So much more oxygen reaches deeper parts of the brain. It goes to every part which may be possibly hypoxic. So there is this new technology called hyperbaric oxygen therapy. This is available, I'm not sure whether it's available in Dar es Salaam, but I'm sure it's available. It's normally used for wound healing. So far, hyperbaric oxygen has been used for wound healing. But what we have found is when we use it for oxygen, when we use it for autism, there are significant improvements, especially when we combine it with many other treatments. So there are a lot of scientific publications that actually show the benefit of this. All this requires is a hyperbaric oxygen machine. It's not very expensive and it is very, very simple to maintain. Most government hospitals, medical colleges do have hyperbaric oxygen. The only thing is they use it for adults. We have evolved a protocol for children, and we have successfully used it in several thousand patients. So we have this unique protocol where children with autism can be helped as well.
Thanks. And is there, I'm asking as a parent, I know it's given in a chamber and sophisticated, environment. Is there a provision for a home-based hyperbaric oxygen?
Yeah, so you do get home-based. The oxygen therapy we use, they are called heart chambers, where the pressure goes up to 2 atmospheric pressure, double of what we are breathing. You can get home chambers, but there the pressure goes up to 1.3 only. So it is a little better than what we are breathing right now, but not as good as medical hyperbaric. Also, those soft chambers are extremely expensive, and then once your child is finished, you don't have any use for that. But you can give home hyperbaric, but the pressure is much less. It's 1.3, whereas we need between 1.8 to 2.